We are poisoning our children. We're mass poisoning this generation of children, and the costs are now, it's bankrupting the state. A lot of it is because of our food. It's the primary, genes don't cause epidemics. They may provide a vulnerability, but you need an environmental toxin. And we know what it is, and primarily it's sugar and ultra-processed foods. And in the countries, I was talking with some of the Democratic senators yesterday and talking about this, in Japan, in the United States, the obesity rate was 3%. When I was a kid, I was a 10-year-old boy when my uncle was president, and it's over 50% today. In Japan, it was 3% in 1960, and it's 3% today. And it's because they don't allow processed foods into their schools. They have cooks, they give the kids really good food. In China, 20 years ago, there was virtually no diabetes. Today, 51% of the adult population is pre-diabetic or diabetic, and it's because they allowed 20,000 fast food joints to be built in China, and they started mass importing American processed food. We are poisoning our children. We're mass poisoning this generation of children, and the costs are now, it's bankrupting the state. Those of you who are governors, most of you are paying about 30% of your budget for Medicaid. And it's bankrupting us, and there's no end in sight to that vertical hockey stick graph line. And the only way, for years, Republicans and Democrats have been talking about how to reorganize the healthcare system, whether it should be private insurance, or whether it be single payer, or public-private hybrid. But all of those ideas are like moving deck chairs around on the Titanic. The ship is going down. The only way that we solve this problem is by ending the chronic disease epidemic. We spend $405 million a day on food stamps. 18% of that goes to soda and candy. So we are giving this population, the poorest population in our country, diabetes, and we're paying for it again at Medicaid. And if you want to drink a Coke, you're in America, you ought to be able to drink one. You can make that choice. The federal taxpayer should not be paying for it. And if you're doing that, it looks like cheap food, but bad food is not cheap. It's much more expensive in the long run.